Welcome back to the MiM26 Shorts. This is Averill Kelly. Today we are joined by Dr. Slaven Bajic, who is head of the emergency department at Izola Hospital on the coast of Slovenia. Slaven, welcome back to the program.
Thank you, Hebrick. It's always nice to be in the Quorum podcast.
Yeah, you've been on talking about ultrasound, but today we're talking about the two topics you're giving at the conference. So one is on ventilators and the other is on team dynamics. So let's talk about vents. What do you plan to present?
Well, I will talk in panel about the difficult airway and vents on the field. So I will talk about strategies and solutions if we have, of course, difficult airway on the pre-hospital area and some situations, strange situations there. How can we quickly resolve them and try to optimize our patient's airway?
Are you going to be drawing from your time in Africa?
Yes. I have some cases from Africa, but also I have some interesting cases from here, from Slovenia. So I will definitely use some of them.
So, and you're also talking about team dynamics. So what do you plan to speak on? Yeah.
Yes, I wanted to talk about team dynamics. Actually, I did also 2 years management in leadership competences in medicine. So I was writing a lot about that. Also, I thought because we have many, of course, medical subjects, everything, I wanted to talk about something, not directly our work with the patient, but something like team dynamics, how it implies in pre-hospital environment. Because to talk about human factors. So how much is important traits of the team leader? It's not important who is that doctor, paramedic, any team leader. So traits of the good team leader and how factors as communications, cognitive load and leadership can affect outcome in critical and austere field settings. That is the base of the talk.
Is this a bit of crew resource management or is this the psychosocial problems of dealing with patients?
More crew resource management.
Okay.
I was talking many times here. I had a lecture about the traits of the team leader, so that how he must connect all the team. For example, how calmness in the difficult situations is the most important thing. That the panic is worst things that we can allow ourselves. So how the team leader transfers his calmness to all the team, how that is important, how some other things are important, and how outcome of the whole operation with the patients is very important, very connected with that.
And is that something that you have to work with within your own emergency department as well as on the ambulances?
Yes, of course. Of course, that's one of the most important things in emergency medicine. Because we all work in teams. It's not nobody's individual there. We all one team. It's not important, of course, who is who. I mean, all people in the team, we are together. All situations we are handling together. And that communication and cognitive load and everything, that's, I think, very important thing.
I agree. And as you have new docs coming into your emergency department, you need to mentor them, don't you, to kind of fit into the team that you've created.
Yes, of course. We have a lot of interns, a lot of residents, a lot of other people. So that's from the beginning, we start to provide them with information how teamwork is important, of course, with other medical information they need to know.
And for your ventilation talk, what are you going to, you're talking about difficult airway as well as ventilation.
Yes. Definitely. And I can present a few interesting cases that I had in my work. With that, both and the difficult airway and about problems with ventilation after we have airway, the next thing. So if we have another problems with ventilation, everything, how can we solve that?
Yeah, definitely a bad day at the office for those of us in pre-hospital. When you have a difficult airway, you can't intubate, you can't ventilate. And do you pull that trigger and do the surgical airway, or do you fall back to LMA? It's a challenge.
Yes, that's a very hard decision what to do in that moment. But I think that is one of the worst situations that one emergency provider can find himself, to not have an airway. I mean, that's the first thing, AB, and you must solve that before you solve everything else. You must know all strategies to try to solve that.
Well, I look forward to seeing you again present at our conference, and it is always an interesting time to sit in the back of the classroom and watch as you teach and as you present your topics.
Thank you very much. I'm glad to be at M&M again, and I'm looking forward for it.